November is Pancreatic Cancer Awareness Month, and experts are recommending you get screened if you're at risk.
Dr. Mohsim Kukar is Chief of Gastrointestinal Surgery at Roswell Park, and he's here to share details about conversations you can have with your doctor on this topic. Good morning, Doctor. Thanks for coming in.
Well, thanks for having me.
Let's talk about it. What are some of those signs you can look out for, and when is the right time to get screened?
Pancreatic cancer is one of those diseases where it doesn't really cause early symptoms, based on the location. But if it's in the right location, it can cause things like, if it blocks the bile duct, it causes jaundice, which is yellowing of your body and your eyes. So that's a sign that's certainly alarming that patients should seek attention. If it blocks the pancreatic duct, which drains all the juices into the intestines, it can cause pancreatitis, which is just severe pain in your abdomen. So patients should certainly seek attention for these symptoms. One of the other symptoms that happens, which is unexplained weight loss. Patients are losing weight and there's no explanation. I think this is something that should be in the differential for that.
And so we talk about those needing to get screened because they're at risk. Who is at risk for pancreatic cancer?
Absolutely, that's a great question. So less than 10% of pancreatic cancers are what are called hereditary pancreatic cancers, where there's, I think we have about 10 to 12 genetic mutations now that we can identify and screen them and put them in these high-risk screening programs, which we have at Roswell. So if an individual has that genetic mutation, then they go periodic imaging surveillance and also endoscopies to make sure that they don't develop cancers. And if they do, it's usually early stages that can be cured.
What are some of the advancements the past few years, going back a decade maybe, in treatment that have really led to more positive prognoses?
Absolutely. I think the utilization of multi-agent chemotherapy, which is 3 different agents that we can combine and target the body. Within surgery, obviously, the advances for our techniques. So Roswell is one of the institutions that, outside of New York City, offers minimally invasive options with robotic surgery to treat these cancers. And then also utilizing radiation therapy for these tumors as well.
How many patients are you seeing even on a yearly basis at this point? Are you seeing an increase?
I think there's probably obviously more diagnoses of these cancers. So at Roswell, we treat we see about over 300 patients annually. We do about 100 pancreatic operations at Roswell. And I think this is very important that, there's actually high-level data that, simple logic of the more you do, the better you get. It really works in this cancer. So I think, if you're getting treatment for pancreatic cancer, it's very, very important to know what the volume of the hospital that's treating, those cancers is.
All right, Dr. Kukar, thanks so much. An important topic, and the work that's done at Roswell to help with that and all the other cancers out there. Very important work. Thank you.
Absolutely.